Hi, I'm Taylor. I'm the narrator. The program used during the following therapy sessions is the Lidcombe Program for preschool children who stutter. There has been a lot of research supporting the idea that parents have an influential role in the management of stuttering. This makes sense because stuttering is typically a developmental problem that starts during childhood. At this time, parents are the most important models for their kids. This makes them necessary in the intervention process for stuttering. Rather than looking at just the child, clinicians should view the entire family as the client. This is what the Lidcombe program does. There are 2 stages to this program. The first stage involves an initial evaluation of the child and weekly therapy sessions that last about 45 to 60 minutes. During the sessions, the parents can observe the clinician's verbal contingencies that are used to respond to the child's utterances. The parents can then discuss how to use these at home. We will first watch the initial evaluation with our SLP, Casey, and our stuttering child, Chrissy, who is here with her mom, Marie.
Hi, I'm Casey. I'm a speech therapist.
Nice to meet you. This is Chrissy.
Hi, Chrissy. It's nice to meet you. So I understand you are here because you're suspecting that she might be stuttering.
Mm-hmm.
Okay, and I understand she's 3 years old and 8 months.
Yes.
Okay. So when are you thinking the stuttering began?
Probably about 3 months ago when she was about 3 years, 5 months.
Okay. And can you tell me about the impacts of the stuttering, like how it's impacting her at home or socially?
Yeah, she's not really aware of it, so it's not really bothering her,
Okay.
but her brother is noticing it and he's having a harder time understanding her, so
Okay.
he's frustrated, but she's not.
Okay, and what's her medical history like? Did you have a healthy pregnancy? Anything?
Yeah, everything is normal.
Okay.
Everything went smoothly.
Did she reach all of her developmental milestones at an average age?
Yes.
Okay. Do you have any family members that stutter?
My brother stutters.
Okay, so her uncle.
Yes.
And he still stutters? He's never recovered?
He never recovered.
Okay. And so why don't you tell me about your home life, like how conversations go at home?
I mean, it's good. We chat, and it's harder for everyone to understand Chrissy sometimes. I think I'm probably the one that understands her the best,
Okay.
but like I said, her brother kind of gets frustrated with her because he can't understand what she's saying some of the times.
Gotcha. And how do the conversations, between you and your husband or you and your son look like? Do you guys talk kind of fast?
Yeah, maybe a little fast.
Okay. All right. And so when you called for the appointment, I asked you to take a recording of her. Did you get a chance to do
Yes.
that? Okay.
Mama, a boon, a boon.
Oh, boon! I like the boon.
That's a cool movie.
Once upon a time, there was a little girl named Goldilocks, and she went to the bear's house, and she wanted to try the porridge, and she went and she found the baby bear.
Oh, hi, I didn't see you there. During this evaluation, several risk factors were mentioned. Chrissy has an uncle who did not recover from his stuttering. Her parents rate her stuttering with moderate severity. Since her onset was after 3 years old, we would think that her stuttering will persist. However, her onset was specifically at 3 years, 5 months, which is sort of a borderline age. This combined with her other risk factors makes her a good candidate to receive treatment. After listening to this recording, our SLP Casey calculated a score of 73% for her percent syllables stuttered. Now, Casey will introduce the Lidcombe program.
Okay, so since we both agreed that Chrissy seems to be stuttering in her speech, I'm going to talk to you about this program. It's called the Lidcombe Program, and you can tell me if you like it, and it would be a lot of you implementing things at home, so you'd be very involved in this.
Okay.
So just tell me what you think after I explain this. So every day you'll have like a 10 to 15 minute structured conversation with her, maybe like playing a game or, sitting her down and asking her really specific questions.
Okay.
If she doesn't stutter, you will praise her. Things like, that was great smooth talking, or I love that smooth speech you just used. Good job, Chrissy. And then you can also have her kind of evaluate, was that smooth talking, and have her like self-reflect on the speech she just had. And then if she is stuttering, you can say things, kind of acknowledge it, like, well, that was a bit bumpy there, and I think I just heard you say some bumpy talking, and then also kind of acknowledge that. Was that smooth talking or was that bumpy talking? And just have her kind of think about it. And then I'll have you rate on a scale and bring that in. We'll meet about once a week. to discuss, what your findings are. And this is for phase 1. And we'll do this once a week until we notice a significant decline in her stuttering disfluencies.
Okay.
Towards the end of the evaluation, Marie and Casey discussed having 10 to 15 minute structured conversations a day where they use the verbal contingencies for the child's speech. These are seen in the first session done at home. They also discussed using the SR scale, which is a severity rating scale for the parent to rate their child's disfluencies on a scale of 1 to 10.
Chrissy, that's such a beautiful drawing.
Thanks,
oh my
Mama.
goodness, I love it. So, who's in the picture?
It's a girl.
That speech was a little bit bumpy. Do you think you could try saying it again a little smoother?
It's a girl.
That was great, smooth speech. What about, is that a smiling sun right there?
It's the sun.
Is that like from the Teletubbies that you love to watch?
Like from Teletubbies.
That was great, smooth speech. So, did you enjoy watching Moana yesterday?
Yeah.
What was your favorite part of the movie?
I really like the part where she went and she found Maui and he really he wanted to take her boat, and I thought it was really, really funny.
It was funny. Your speech was a little bit bumpy, honey, okay? Just letting you know. Where was he going? He was just falling off the boat and everywhere, and then he just popped right back up.
He was so funny. Hey, I love
Is
that
that
chicken.
his name? I didn't know that was his name. That's funny. You're using great smooth speech right now. I'm really loving that.
Hi, so how are you doing this week?
Hi, I'm good. How are you doing?
Good. It was so nice to see you at the country club the other
You
day.
too. That tennis is looking good.
Yes, yours too. So why don't you tell me how this week went?
It was pretty good. So we had a couple conversations with
Good.
Chrissy over there, and I was trying to do what you had told me to do
Okay.
with the Lidcombe, and so I talked about, I'd tell her if her speech was bumpy or if it was smooth.
Okay, and so I asked you to take a severity rating score. So based off all the conversations you had, what do you estimate that
I would say probably a 5.
at? A 5? Okay.
Yep. Some days it was 4, some days a 6. So it was, most of the days were 5.
Okay, so now we're gonna have Chrissy come over.
Chrissy, sweetheart, come here, please.
And I kind of want you guys to demonstrate. It doesn't have to be the whole 10-15 minutes. I just want to watch you guys
Hi.
have one of those structured conversations, and then we'll kind of review afterwards. You don't need to use those contingency those. You don't need to give her any feedback on her stuttering. I like your slippers. Those are so nice.
Do you want to talk about how we went to the dog park yesterday? Didn't you just love that?
I loved it.
What was your favorite dog there?
I really liked the wiener dog. He
That was a
was
cute
so
one.
small, and he was brown, and it was so funny when he played with the other dogs, and I liked petting them all.
That little wiener dog, you could have just put a hot dog around him, a hot dog bun.
Well, I'm glad you had so much fun at the dog park. So why don't you tell me what you would rate that on the SR score?
I think that was maybe a 6.
A 6? Okay. So while she was talking, you probably saw I was writing down what she was saying, and I looked at the percentage of the syllables that she used and how many of those she was stuttering. So I came up with about 68%. I was doing it kind of quickly, so give and take. So it's pretty close to your SR scale. So why don't you tell me some things that you said to Chrissy over the past week whenever she would stutter? Like, what are some of the responses you would use?
Yeah, honestly, I was kind of running out of ideas here and there. I would say either tell her that was really good, smooth speech, or that was awesome smooth speech, or I would tell her that her speech was bumpy, and that was the word I just kept using, and then I'd be either like, oh, that was a little bumpy, can you try it again, or I would just point it out.
Okay. And so did you use any of those like self-evaluations that we talked about?
I forgot about those.
That's okay, that's okay.
Oh, I'm so sorry.
No, it's fine. So we'll have Christy come back and I'll demonstrate some of those for you so you can, and then I'll let you practice some so we can make sure going forward we use those.
I found a cookie.
A cookie? What are your favorite kinds of cookies?
I really like chocolate chip cookies.
Okay. So that speech you just used, was that a little bumpy, you think?
Yeah.
Yeah. So you want to try saying it again? Let me know what type of cookies you like.
Chocolate chip cookies.
That was much better, wasn't it? All right. So why don't you talk to her and you can practice it as well.
Okay. What do you like to have for breakfast in the morning?
I don't know.
You don't know? What about those English muffins that we have, and sometimes I put Nutella on them for you?
I do like those.
Now see, that was a little bit bumpy just at the beginning. Do you think that was a little weak?
Yeah.
Okay. Can you try it again a little bit smoother?
Yeah. I like those.
That was great. Very smooth.
All right. That was great. So we'll meet again next week and you let me know how it went.
Okay. Thank you.
Okay. So welcome back. It's been about, we've been seeing Christy for about like 3 months now. So what, for this past week, what would you say her SR score was?
I think it's about 2.
A 2 again, that's great. It's been 3 weeks now that you said it's a 2. So I think now we can move on to phase 2 of the program. With this, we'll start meeting every other week instead of once a week. And eventually we'll phase out to once a month and then once every 8 weeks. As long as she stays consistent with where she is at a 2. If you think she's moving back up to a 5 again or something, you can let me know and we'll start meeting once a week again.
Okay.
So yeah,
That sounds great.
awesome.
Thank you.
At this time, Casey and Marie have agreed that Chrissy can move on to phase 2 of the program. This is because she kept the severity rating scale of 2 for 3 consecutive weeks. For stage 2, Chrissy will need to maintain all of the progress she made in phase 1. Marie should be able to use less verbal contingencies from this point on. Like Casey mentioned, the weekly sessions can decrease to being every 2 weeks, then once a month, and eventually once every 8 weeks.
So how was the dentist today?
It was good. I got bubble gum toothpaste, and I got a sticker at the end, and they had Toy Story on.
Toy Story? Do you love Woody?
I do. I love Woody.
That's some good smooth speech right there. Do you like when he wears his cowboy hat and his boots?
Yeah, but I really like when he plays with Buzz.
Do you think that was a little bumpy maybe? What about, who's Woody's girlfriend? What's her name? Do you remember?
Jessie.
Jessie. She's really cool. She has that country accent like we do.
Mm-hmm.